Okay, all ready?
Yes, sir. Yes, sir.
All right. Good afternoon. Today we are introducing a new state organizational effort to help our communities recover long-term from COVID. So I'll be joined by OFM Director David Schumacher, as well as OFM's Dan McConnon, who will chair the Washington Recovery Group. And they'll be available to answer questions about this effort as well. And to answer questions about COVID, Dr. Lofi is available as well. Before we get to that, however, I'd like to let you know that this week we're moving forward in 5 counties in our phases. These phases currently are in Safe Start's modified Phase 1, also known as Phase 1.5. And today these 5 counties are moving forward fully to Phase 2. This applies to Yakima, Benton, Franklin, Douglas, and Chelan counties. And I have to say, it's a mark of progress for these counties. Local leaders in these counties have worked hard to knock down this virus, and they have done so. They're not out of the woods yet, we know that, neither they or we. At least 80,000 Washingtonians have been struck by this disease this year. But these counties and their people have made tremendous progress. For example, Yakima County in early June was averaging 753 cases per 100,000 residents. And they're currently averaging 93. So to go from 753 to 93 is enormous progress. The count in Benton County is now 109 per 100,000 people. And that is 1/4 of what they were in July. You'll see similar trends in Franklin and Chelan County as well. So the COVID risk was off the charts for these counties last summer, and they got it down because the majority of the residents in those counties are doing the right thing to get these numbers down. We're really happy about that. I want to give kudos to the local leadership, local political leaders, business leaders, community leaders, agricultural labor organizations who all pulled together to ask their residents to join them in masking up, which they have done. And as a result of masking up, they have knocked down these numbers dramatically. It is a testament to the commitment of citizens to do scientifically credible things to save themselves, and that's what they have done. 3 months have passed since we hit pause on the Safe Start reopening plan, and over that period, the COVID risk assessment has leveled out when you compare the 5 modified Phase 1 counties to their neighbors, most of which are in Phase 2. So given this leveling out, it is appropriate to allow these 5 counties to join the 17 other counties who are today in Phase 2, and that will align them better with the rest of the region. You know, this change is relatively modest when one accounts for the additional activities that will be allowed. It means some larger occupancy for religious services, restaurants, wedding receptions, and more under Phase 2. And you can find all of that information at coronavirus.wa.gov. But we're happy about being able to make this progress. And again, kudos to the people of these 5 counties that have allowed us to make this progress. I know they know we're not done, though. There's still improvements to be made, and wearing masks where appropriate in our homes. We got more work to do. So we know that this has and will continue to be a long battle with COVID-19 in every county of our state. Obviously, it doesn't mean we're out of the woods. And it certainly doesn't mean that we can ignore the horrendous potential of these super spreader events like we saw at the White House. It means we're in this together. It means we have to continue to take the science seriously if we want to avoid more illnesses and ramp up our path to economic recovery. The majority of states in the United States today are seeing an increase in COVID activity. Europe is also experiencing this. It is a result of fall, cooler weather, people going inside. But this is no time to allow super spreader events. It's no time to let our guard down, even in our homes. It's no time for large parties where people are not socially distancing and not wearing masks. It's It's no time to stop all the things we have been doing that have had such success to date, and that is success. We should reiterate, I didn't look at that this morning, but a couple days ago, we were in the top 5 states of having the least amount of COVID activity. So we've had progress, and we just really would hate to see our efforts to date be superseded if this COVID comes racing back because we've given up the effort. And frankly, folks are working hard on this, and those who aren't, we need them to pull on the rope. We don't want a few super spreaders to ruin the progress that thousands of people in Yakima County and other places have done to save ourselves from this beast. So the crisis isn't over, but we want to start thinking about the long-term recovery, economically and otherwise. The tragedies of 2020 don't have to become chronic difficulties. Going forward, we have an opportunity to rebuild in new ways. We know a recovery is inevitable. How we recover is crucial. So my staff and I have been looking for ways to mitigate the impact already. We've included $25 million in grants for businesses and another $15 million announced last week. In all, the state has distributed nearly $1.8 billion in federal relief funds to help with response and recovery efforts. That includes $435 million in economic support, $496 million for local governments, and nearly $70 million in food assistance. But we need to move forward to mitigate the severe economic impacts of this pandemic in safe and creative ways. We're always looking for the ways that the state can help. And today's announcement is the latest. So we're announcing we are creating the Washington Recovery Group under the Office of Financial Management. And this group is going to help the state agencies coordinate recovery efforts and local governments, higher education, and private sector. We want to work with the appropriate state agencies to holistically address the challenges this pandemic has confronted us with. Now, this group won't be necessarily developing specific recovery policies, but they will provide feedback and be crucial in implementing them. Priorities include, obviously, education and child care, health and health care, community and social services, housing, small business, jobs, unemployment, energy, and utilities. They're going to represent a diverse group of stakeholders from state agencies, boards, commissions, tribal partners, local agencies, and the private sector. And they'll be guided by principles of equity and social justice as we make these decisions. We all want to recover this as soon as possible. We know that people are hurting financially, and this has been a most difficult year for all of us. I know people are looking to turn that calendar to 2021. But I think this advisory group can help coordinate our agencies so that they work together, not at cross purposes, so that they have a central way to make sure that they're bringing efficiencies in their own work all to the common end. To make sure we have situational awareness, to know that we work well with local governments. And most importantly, it will support changing how we conduct business so that the state can be better prepared for future events. They'll hold their first meeting later this month. So with that, I'd be happy to stand for questions, and David Schumacher, Dan, and Dr. Lofi are also available.
First question comes from Rachel with AP.
Governor, many of us learned today that the lieutenant governor has not been drawing a salary and has been living in California for the past 6 weeks to start Jesuit training. How is the state well served by a lieutenant governor who no longer resides here?
Well, the lieutenant governor, we want to make sure fulfills the responsibilities he has. At the moment, the legislature is not in session, so he's not called upon to preside over the Senate. And so at the moment, I'm unaware of responsibilities that are not being conducted. I suggest you ask the lieutenant governor that question. I'm not fully aware of his activities. So I would direct your request to the lieutenant governor. If I'm advised that if we do go back into session, there will clearly be need for accommodation in that regard. I'm advised that the Senate has told us that they have a means to accommodate that will not be a problem. That's what we have been advised.
Rachel, would you like to ask a follow-up?
Sure, and I will note that we had reached out to the Lieutenant Governor, but have been told that he's unavailable for interviews. The Secretary of the Senate today, though, said he never received any formal notice about it. So given the key position as part of the Senate, regardless of whether or not they're in session, shouldn't there have been more transparency about his status?
If I would have thought that he would have notified the Senate of his position and availability, so that's surprising to me if that's the case. Obviously, that should be coordinated. Just what I've been advised just in the last hour or so is that the Senate has provisions that should be able to not be a problem. I don't know what those are. I will be making some inquiries about this to make sure that there is a workable way to move forward.
Next question comes from Joe with the Seattle Times.
Does this change your thinking any way about a potential special session after the election, Governor?
No, if we call a special session, we will find a way to make sure it's productive and workable. I don't see this as an impediment because we can find another presiding officer. Frankly, his vote is not the deciding vote at this moment, given the makeup of the legislature. So I don't see that, from what I know at the moment, that would be impediment for a session being productive. But as I said, I will ask the Senate what their thoughts are, and if I have some more insights on that, I'll share them with you.
Joe, would you like to ask a follow-up?
No, thanks.
Next question comes from Essex with Cairo 7.
Yes, Governor. Mentioning a special session, yesterday Republicans had asked you again for one in their news conference. Could a special session be a way to build the cooperation needed to address budget problems in January?
Well, a session certainly will be. The question is when to have it. As you know, there was concerns about our financial situation months ago. So I acted and took action as governor. Folks wanted to see reduction in spending, and so I cut over $500 million of spending. And there wasn't any specific proposal about additional cuts that we did not effectuate. We decided, and I think it was the right decision, to not make decisions earlier like that because we didn't know what our financial condition was going to be. That turned out to have been the right decision because we had an additional $4.5 billion available to us that became available to us in the revenue forecast. The legislator might have made some poor decisions had we had one 3 or 4 months ago based on faulty economic assumptions. So we avoided those bad decisions. We now have this biennium, we're in the clear this biennium, so there's no reason for a special session at this moment. Now, whether the next session takes place in November, December, January, we are going to have a good session. I will propose in December a balanced budget. I'm confident we're going to make the right decisions for the state, and we're in good position to do that. And I heard a lot of folks that just wanted to slash healthcare funding and mental health care funding and goodness knows what else. And I'm glad we didn't do that in the middle of a pandemic. These folks needed help. Now, the thing that's frustrating sometimes is some of the Republicans are very critical about not having a special session because they wanted to cut spending. And I said, oh, you wanted to cut healthcare spending? They said, no, no, no. I said, well, how about mental health care? They said, no, no, no. How about schools? No, 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 no. Well, tell us what you really want to cut, because once they actually tell us, it's not very popular. I stepped up to the bar, made some difficult decisions to cut $500 million of spending. That's tough. A lot of those things are things I had just voted on. But I think we're in good shape. We will have another session. It will be productive, and we'll steer this course.
Essex, would you like to ask a follow-up?
Yes, a question for Mr. Schumacher. How do you see this business task group coming together to really help those very small businesses, many of whom say they were virtually ignored in the earlier relief plans?
Well, I think this thing is much broader than just a business recovery. This is about all of the state, about state government, about the private sector, about the public. But I think, as you know, in the CARES Act, we drove a lot of money out for small business relief. We are likely to have another batch coming soon. And a lot of the money that was driven out to local governments, cities and counties did a good job of investing that money into small business relief. In addition to that, we put $100 million into rental assistance, which is relief for landlords, who are landlords of people that are having trouble paying their rent. So we have committed quite a bit of money over the last few months into exactly this kind of community.
Next question comes from Alexis.
By the way, if I may, just from, there may be, look, these were small business grants. We just did an additional $15 million for very small businesses. And the small businesses that I've met were frankly quite appreciative of that. I was at a meeting the other day with a salon and a small manufacturer who makes parts for the aerospace industry. And they were very appreciative, and they used this in very creative ways. And it's helped people. These were relatively small grants, but it can be the difference between keeping your business open or not. So we have, and we will continue to look for creative ways to help.
Next question comes from Alexis with the News Tribune.
Governor, do you have data about mask compliance in these modified 1, soon to be phase 2 counties or elsewhere in the state? Are there figures about how many people are wearing masks in different settings?
We do. In Yakima, the chamber led a survey and found, I think it was 95% compliance in stores to comply with our executive order, the Department of Health's order on this. That was very gratifying because we attribute the significant, if not the major part of that huge drop from 700 down to 90 to mask usage. And it was really gratifying because it shows that this works. You know, it's really nice to have a tool that is just a piece of cloth that can save people's lives. And that has happened in Yakima. It's happened in Benton. This has happened because people there have decided to wear masks. But it isn't 90 to 95% in quite a number of places. So we need to up our game. And what the infectious disease control people tell us is that there's a big difference between 75% and 90%. And we need to get to that 90%. We need to get over this unnecessary argument that somehow a mask is a political statement. All it is a piece of cloth. All it is a statement that you care about people around you, you don't want to infect them, and you care modestly about yourself that you not become infected. That's all it is. So we need to get over this argument. And we do need to get over if people, there are unfortunately some folks who are just, you know, irresponsible. I think it's fair to say Donald Trump's irresponsible. Allowing a super spreader event, holding all these rallies without masks. We need leadership here on a bipartisan basis, and there's no reason we shouldn't have it.
Dr. Lofi, would you like to add anything?
No, I think he covered it pretty well.
Alexis, would you like to ask a follow-up?
Yes. Governor, do you think we're where we need to be with testing? How are we doing?
Well, I would describe it as relatively well. I think that we're in the tens of thousands of tests. My experience is that people who want to test generally can get access to a test. We have some antigen testing capability coming on, and we look forward to its application. There are some issues about the antigen test because they have a relatively high false positive rate, so we have to use them with a grain of salt. But I would not describe testing as a major impediment to us. I think the major impediment is our not being able to get to 95% compliance with masks and social distancing. And we've seen what happens when we don't get that. We get outbreaks at fraternities and sororities. And the challenge we have now, if I may, we've been working hard on this, but I think we have to recognize there's a new challenge we have that we haven't had in 2020 yet. And that is we're going inside. We're going into our dinners, our birthday parties, our social gatherings, watching the incredible Seattle Storm and incredible Seattle Seahawks and the Sounders. And as we go inside and we sit on our couches with our friends and we don't wear masks, that's a risk. And finding a way to adopt the thoughtfulness we've had when we go shopping to having the same level of thoughtfulness when we're in our homes with our friends, we just have to lift our games. You know, if we could lift our games half as much as Sue Bird and Russell Wilson on this subject, we'd be in really good shape. And I think we can do that, but it's necessitated by the science and the weather. So we're starting a communication effort to share this scientific information, to share how people can enjoy social togetherness while simultaneously protecting everybody. So rather than telling people what not to do, we're going to try to help them understand how to do it safely, because we all are desperate for society and our friendship and our families, and we got to figure out a way to how to do that safely. And that involves a little bit of distance and some masks. And if we can do that, we're going to get through this. We're going to reopen our economy.
Next question comes from Jim with the Spokesman Review.
Governor, I'm wondering if you can clarify something for me, because last week a couple of times and again today, you said that Republicans wanted a special session so that they could cut health care. But legislative Republicans say they have never proposed or suggested cutting health care. Rather, they proposed not starting new programs and canceling raises for state employees. Can you point to a proposal that legislative Republicans sent you that would cut health care and tell me by how much?
Yes, every single one of those folks support Donald Trump. And Donald Trump and the Republican Party have a very clear effort to eliminate the Obamacare. They've had an obsessive desire to do that, and every one of these legislators support that effort because they support Donald Trump. You can't support Donald Trump and simultaneously say you want to protect Obamacare and health care for hundreds of thousands of Washington citizens. You also cannot say that you want a special session to cut where the spending is, and the spending is in health care and education. And so if they really want to cut spending, they need to put on the table what they want to cut, and they need to say they're not going to support Donald Trump anymore in his efforts to destroy healthcare in this state. And that's what they're doing. And I don't think that's too judgmental. I think it is accurate. Now, if Donald Trump or the Republican Party could propose a substitute to really protect people against loss of coverage for pre-existing condition, and a way to provide insurance coverage for hundreds of thousands of people, that would be one thing, but they simply have not. You got to understand that, you know, we're going to have an election coming up here, and that election will have consequences. I can unequivocally say that Donald Trump and his party want to cut health care in my state, and that includes these legislators. And the minute that one of these Republican legislators said, I am not going to vote for Donald Trump and I'm not going to support him because of this, I'll give him some kudos.
Jim, would you like to ask a follow-up?
Yes, I'm wondering if today's movement of those 5 counties to phase 2 means that phases are no longer paused and that other counties may soon be moving up or some even moving down.
Well, all those conditions are dependent on what happens with the virus. So all those things are possible. But if I could characterize this, I think this is more in an effort to do 2 things. One, recognize the progress these counties have made because they have been dedicated to saving themselves, and they've done that. And 2, a matter of fairness, because without raising them up, there were some counties with higher infection rates, significantly higher infection rates than they had, and yet these 5 counties were still in a lesser level. So it was both to honor their work and to increase some fairness. It doesn't portend necessarily major movement through the phases. We have to understand, although we have made tremendous progress, better than 45 other states, we now are seeing an uptick to some dimension. We hope it's temporary, but we got to keep our eye on the ball.
Next question comes from Scott with Northwest Public Broadcasting.
Hi, Governor. Following up a little bit on what Jim asked, in specific to Whitman County, which is in phase 3, but there's, as you know, been a huge spike in cases in Pullman's college-age population since mid-August. The county announced its third total death today, and all of those deaths have been just in the past week in older populations. Hospitalizations have also been going up in the past 2 weeks. Health officials previously said that they were worried about the possibility of the WSU outbreak spreading into the broader community, and it sort of appears that's possibly happening here. So I'm wondering, are you considering taking Whitman County back to a previous phase or otherwise taking additional mitigation steps in Pullman?
Well, we certainly are trying to work with the college and the community every way we can. As you know, I was there a couple of weeks ago to try to help them focus on this effort. So we're doing everything we can to mitigate this by having strong measures to get the students to show leadership. I met with the police chief, who is taking law enforcement action of some dimension to find people who are having parties. The school administration is doing their share. There's possible sanctions in the school and academically if folks don't comply with the rules. So we are doing that. I can't say we're actively considering changing the phase for Whitman County at the moment, but we do have to realize that, what goes up can come down, and that's just a reality. And the way to prevent that is for all of us to mask up. It seems so simple, but it is so profoundly life-saving. Its simplicity cannot camouflage its capability of saving life. And its unification should overpower this ridiculous, somehow partisanship that people thought this was an expression of your politics. All it is trying to save cougar lives, and I'm all for that. So I hope that we can increase that in all dimensions.
Scott, would you like to ask a follow-up?
Yeah, regarding the advancement of counties into more phases, for example, the mayor of Spokane has been pushing for going to phase 3 very vocally for quite a while. If you look at Mayor Woodward's Twitter account, I wonder if you've considered, or if maybe Dr. Lofi could speak to it, if you've considered whether the current approach or the metrics for phases that were largely designed in the spring and around May need to be reevaluated or changed to address the situation now.
Well, look, we're constantly evaluating this, and we haven't made any decisions today, but we're constantly trying to evaluate, is there a better way of doing business here? At the moment, we haven't seen a better way at the moment. Doesn't mean we won't in the upcoming weeks. But again, I want to come back to this. No matter what phase you're in, we know one thing, and that is the more people wear the mask, the more lives we save and the faster we will build our economy. That's the thing we are focused on right now, on the thing that we know that works. And frankly, it wouldn't do us any good if we increase the phase now, fewer people wear masks, more people get sick, and then we have to go backwards. So that really is what we're keeping our eye on the ball on now.
Next question comes from Jerry with the Everett Herald.
Governor, I wanted to ask about education. With the cases rising all around the state, K-12, and now we see colleges, WSU and UW, case increases. Are you in the Department of Health looking at revising the guidance and the parameters that are being used for K through 12 schools and potentially ordering the colleges to close and return to fully online learning that would reflect the leadership you talked about you're needing right now?
We haven't seriously considered closure for colleges. As you know, in the K through 12 system, we are making recommendations. We are not making those decisions. Those decisions at the moment are made by local school boards and communities. We do think there'll be some fairly modest adjustments in the upcoming days of some of our recommendations that will more align the in-school education with some of the athletic and recreational guidance that we gave a week or two ago. So we probably will have some modifications in the upcoming days to those.
Jerry, would you like to ask a follow-up?
Yeah, I wanted to go on the budget for a second. You mentioned a moment ago, again, we're in the clear on this budget and not doing a special session avoided bad decision, which I presume would have been by the Democrat majority in the legislature. But the economic forecast shows that there is still a $2.3 billion shortfall. And to use reserves, you're going to need votes of Republicans. So I guess I'm trying to clarify, who have you spoken to about it? When will you start talking with Republican leaders about how to address that shortfall?
Well, I think that serious discussions will start when we get the next revenue forecast. We will propose our budget. We'll have lots of talks at that moment. So trying to find the way forward. The point I want to make, though, is that will be a better time to have those discussions because we will know where we are financially. Look, if you're going to do a budget, it's kind of nice to know how much money you have coming in. We will have better information about that, later rather than today. We learned that because, there was an enormous different viewpoint in revenues today than there was several months ago. So my point is that I can't tell you exactly what the revenue forecast will be, but it'll be different. And we will have better information. And there is no reason, except maybe politics, to make those decisions today. They'll be made better when we have better information upon which to make them.
Governor,
and there's no reason to do it right now. That's the whole point. It's just not necessary right now. There's no advantage to doing it right now.
Governor, if I could jump in, this is David Schumacher. Jerry, I think it's important to know that there's a few things going on. One is the significant savings that we have made this summer that will show up as we close the books on the fiscal year. Two, whatever we get from the federal government. And three, the use of the reserves, the considerable reserves, takes a 50% vote at times like this and not a 60% vote. Not that I think that anybody was going to withhold the vote to balance the budget, but assuming all that, we are easily in the clear for this biennium and have made a good start on the next biennium where we obviously still have work to do.
Great.
Now, and I just want to reiterate what David said, depending what hour of the day it is, either we've got a good chance of further assistance to Congress or talks are dead. And that changes hourly depending on the tweets coming out of the White House. But we have not eliminated possibilities of federal assistance that is really needed.
Next question comes from Hannah with Cairo Radio.
Hi, Governor. Just following up on what you just said about federal assistance. We heard from Snohomish County health officials today, really a desperate plea to everybody in the community to call their congresspeople and ask for them to support an extension of the CARES Act. They're going to run out of money by the end of the year for their contact tracing and all of the other things that they've been doing as part of their pandemic response. Is there anything you're actively doing or any sign of hope that you have that you can share?
Well, yes, I talk to our congressional delegation every week and reiterate these points, and I hope that they are successful. There's some diversity of thought between the parties of our delegation. And I hope that the party I belong to prevails because it'll be better for Snohomish County. I think that is very clear. I will tell you that they have on both parties a difficult and an unnecessarily increased degree of difficulty. And that is a president who is of such mercurial character that it makes negotiations much more difficult for both parties in this regard, and that is most unfortunate. It would be helpful to have a steady hand at the tiller at this moment to guide negotiations. Unfortunately, our country does not have that right now. But we remain hopeful. The need is clear. And if it has to wait till January that, you know, we have some new members of the U.S. Senate, there might be somebody different in the White House possibly, and that may increase odds that good things will happen.
Hannah, would you like to ask a follow-up?
Yes, and this could be for Kathy. Again, from Snohomish County today, really hearing the alarm bells go off and a rise in cases there from the last 2 weeks. That's been pretty significant. Heard something similar today from King County health officials. I'm wondering how that relates statewide.
Yeah, so statewide, we are starting to see an increase in cases, and I'll show you more data tomorrow on our normal weekly press event we have with you. Most of the increases we're seeing are within our most populous counties, so within the Puget Sound, and Clark County and Spokane County. Those seem to be the counties that are starting to see an uptick in cases. So unfortunately, that's not the right direction. And therefore, it's important for people to know this so that everybody can, really think again about all their activities they're doing throughout the day, and making sure that they're wearing their masks when they're around other people, even when they're at work during breaks. If they're having people over to their house, even if they're their best friends, you still need to wear masks, when you're around other people, particularly those you know well, where I think people tend to want to take it off. Really need to double down and make sure everybody's wearing their masks and social distancing and really limiting those social interactions.
Next question comes from Luke with the Yakima Herald Republic.
Hi, just in terms of moving Yakima County up to phase 2, obviously, like you said, the cases are down quite a bit from the summer, but why was now the right time to move into phase 2 as opposed to 2 or 3 weeks ago when cases were even a little bit lower?
Well, I know that you'd like to focus on the good news here. Decision-making doesn't take more than 10 minutes. It takes more than 10 minutes to make these decisions, and we've made them, I think, as timely a fashion as we could. We're happy to be able to do this, and we want to focus on that part of this message.
Luke, would you like to ask a follow-up?
Yeah, just will this move to phase 2 change anything as far as youth and adult sports, given the guidance that was issued last week?
Kathy, can you answer that? I don't know if we have Nick on the line.
Yeah, so they'll be able to follow the phase 2 youth sports guidance. And, technically we did not have youth sports guidance for the modified phase 1 counties. The sports that are associated with school have always been up to the school. But for sports that have happened outside of the school, they will now be able to follow the phase 2 guidance that was issued just a week or two ago.
Time for 2 more questions? Time for 2 more questions. Next question comes from Carolyn with the South Seattle Emerald.
Hi, yes, this question's for Director Schumacher. Obviously, the rate of uninsured people in the state is today, but back to where they were pre-COVID. As flu season coronavirus, do you expect to see the uninsured rate climb back to or even past May's levels with regards to, the number of people losing their jobs and obviously that being connected to their health insurance?
Okay, I'm not sure I'm the only one, but you were cutting out a little bit. But I think the question was, what does the long-term forecast assume for unemployment? And I think, that's for the Forecast Council, which I'm a member of, will weigh in on that. I don't think the forecast is for a big increase in unemployment in the future. I think we are hoping for gradually coming back to previous levels, and that will help our budget. Obviously, what we found in September was that the severity of the problem that was predicted in June wasn't nearly as bad as was originally forecast, and that was good news. the depth of the hole was much smaller than we thought, but we're still gradually digging out of that, and I think it's going to take a while.
We need to add to that. I would agree with David's assessment, except unless the Supreme Court, the new Supreme Court, which we think will have a new justice on it, vitiates this whole healthcare infrastructure, which is a huge risk. Our uninsured rate will skyrocket if that happens, or if President Trump gets his way and destroys Obamacare, which will also cause the uninsured numbers to skyrocket in the state of Washington. These are real risks. Elections have consequences. Voters are going to make the decisions for our country and our state. And these decisions, to some degree, are dependent on what happens in Washington, D.C. I think people know where I stand on these issues. I'm in favor of health care, especially during a pandemic. And I'm in favor of leaders stepping up and say, let's all get together and mask up and not have these super spreader rallies when people are very close to one another and not wearing masks. And, if people forget how important that is, think of Herman Cain. This has consequences. These are life and death decisions. And we sure could use more leadership on this subject.
Carolyn, would you like to ask a follow-up?
Yes, I'm sorry about going in and out. I hope this is better. But Governor, if the worst happens as you just outlined, or the uninsured rate goes up independent of the election or SCOTUS, what happens with SCOTUS, what's the state doing to prepare for a possible uptick in uninsured rates? How, if at all, will the state be taking care of families who are at highest risk of losing health insurance?
We are doing the most important thing we can do, which is voting. Voting can save people's health care. And this is not a statement how to vote, but I hope you vote making an assessment what can save health care, and it's pretty clear. So we're voting, and that's what we can do right now. There's not a lot else we can do at the moment, but that's pretty important. So I encourage people to vote, and I hope people will vote to maintain health care in our state and our nation.
Any other questions? Nope.
Okay, thank you very much. Please mask up. Be well.